In 2026, are lifestyle spending accounts still relevant as it relates to employee health and benefit strategies? Hey guys, what's going on? This is John from Friends with Your Benefits. Coming out of COVID, lifestyle spending accounts, also known as LSAs, were the hottest benefit topic around, and many employers implemented lifestyle spending accounts as a way to attract and retain talent and also provide something different. But now that we're in 2026 and benefit costs continue to rise, are LSAs something that employers should continue to offer or perhaps implement if they don't have one today? Joining us today, we have Kathleen Harris, an executive at Forma. Hey, Kathleen, how's it going?
Welcome to the show.
Nice to meet you, John. Good to see you.
So, Kathleen, you've seen the full world of benefits from consultant, HR leader, and now subject matter expert at Forma. Really want to hear from you and your diverse career background. What ultimately led you on this career journey?
So I'd like to say that it was intentional, but it was accidental. I have a background in public health. Between my first and second year of grad school, I had an internship at Towers, and I realized that population health and employer healthcare were they overlapped quite a bit. I ended up in benefits, and then I ended up in-house at a large corporation, which I say is one of the best 12 or so years of my life. Were running benefits for a large corporation. I had an amazing team. I loved doing well for my employees. I loved delivering benefits for my employees. And then about the time COVID began, my company was acquired. And I thought that during the New York on pause period during COVID, I would do a little consulting. And I ended up doing some consulting for startups, and I ended up at a startup, and now I'm at my second startup. So I guess I got that bug later in life as well.
Very cool. So no, I appreciate your perspective. It's not every day that we talk to someone who's really seen all aspects of the HR life cycle. So really, we kind of teased it out when we did our intro, but from your perspective, ultimately, how would you define a lifestyle spending account, and how would you ultimately think about it differently compared to the other flexible benefits that are available in the marketplace?
So the great thing about a lifestyle spending account is it is post-tax, which means you're not held to some of the non-discrimination testing and other regulations that the pre-tax FSA, HSA, HRAs are. So you can really define them how you want to define them and apply them to different populations. So you could have part-timers getting a different LSA. You could have different geographies getting different types of LSAs based on needs. They're really very, very flexible. I know we use that word a lot in the LSA space, but they really are flexible. So, and LSAs, I think, are going through a little bit of a shift. They were sort of the catch-all, as you mentioned in the beginning, during COVID. So the quick transition from what was 2 weeks on, 2 weeks on pause, I think they called it in New York City. It was a year on pause. People quickly needing to work from home, having different caregiving needs because their children weren't in school, things like that. So LSA kind of became this catch-all for employers to be able to deliver benefits just in time as employees needed them based on their personal situation as they were working through COVID. And now we see employers starting to use them very strategically. So using them to deliver well-being benefits, whether that's mental, physical, financial, or other. Social is a big delivery of well-being benefits. And then also we see people using them a lot for caregiving, for education, the upskilling and the reskilling, a lot of activity around AI and nervousness around AI and people learning how to work with AI day to day is driving a lot of the education interest as well. So very strategic uses of the benefits is what I'm seeing in terms of lifestyle spending accounts now.
I definitely really appreciate that perspective. So no surprise to many of our viewers, but employers are really facing very high benefit cost pressures right now, right? Just based on some of the most recent surveys that are available, healthcare cost increases are at their highest level in over 15 years. Really just want to hear from you, Kathleen. How can a lifestyle spending account help employers reduce or perhaps better manage their benefit costs?
So what we're seeing from a lot of employers is a couple of things. One, going back to basics in terms of focusing on the well-being pillars we just talked about. So a lot of well-being programs got super broad, attempted to have something for everyone. They kind of overlapped with other point solutions. Things got a little bit confusing for employees. Maybe the utilization wasn't there. So we are seeing some consolidation into a lifestyle spending account and then focusing that budget on very strategic initiatives via the LSA. Obviously, healthcare costs don't ever seem to go down, but this is a particularly terrible time for renewals, or this has been a really rough year, I should say, for renewals for medical. And I think there's a lot of pressure to figure out how to balance what can I deliver through the health plan? What do I have to do in terms of making changes in plan design? And then what can I give? And in some cases, by consolidating or reducing spend in other areas or repurposing budget, an LSA can be a give as well. So it's a little bit of a balance between both.
So I just want to dive into that a little deeper, right? How do you actually go about measuring ROI for LSAs?
So I think the ROI question is always interesting. And I used to always say, if I got the ROI I was promised from every vendor, I would have been a profit center, and benefits never was a profit center. But I do think that there's varying ways to measure ROI. And I think there's kind of the literal measurement dollar for dollar, but also too, we see a lot of employee engagement surveys and scores from our customers where the LSA is ranked very highly. It's usually 2 or 3 in terms of top ranked benefits, sometimes beyond just behind everyone's favorite summer Fridays or, extra days off. It's never the 401k match that gets the attention it deserves. But if you offer days off and you offer a lifestyle spending account, they tend to rank very high in employee engagement. So I see that as really more of the ROI aspect of it. You could get into also the productivity aspect by being able to supply, not just the well-being aspect, but the caregiving LSAs additionally, help people be productive, be their best at home, at work, at play. People bring their whole selves to work. And I think LSAs are a great way to help employees manage their life in and out of work.
Great. So I think I saw, Kathleen, right? I think I saw on LinkedIn that Forma released your latest annual benchmarking report. I'm just curious from your perspective, what were the biggest trends that came out of the 2026 Forma benchmarking report?
So lots of interesting trends. LSAs are not just for tech companies. We've known that for a couple of years, but we really saw that in the data this year as well. The global equity piece. So a lot of times, U.S. benefits professionals will be focused on their U.S. population, and there's lots of point solutions in the U.S. And obviously, we deliver healthcare very differently in the U.S., but we tend to be very focused on rolling out those types of things here. And we forget the global equity piece of it. We're seeing employers really start to think about, how do I make sure that everything is fair and equal not necessarily equal, but as fair as possible for their global populations. And they're using, so we're seeing LSAs being used globally. We also saw, as I mentioned, caregiving and education rise to the top. The all-inclusive lifestyle spending account, the one that kind of rolled out during COVID, where they were trying to, cover as much as they could in one account, is still very prevalent, but it grew slower than the other more strategic lifestyle spending accounts I mentioned around caregiving, education, and total well-being.
Did anything surprise you in the report? Sometimes from a consulting perspective, or if I look at a benchmark report, there's always some random story, right, that kind of stands out. In this year's report, was there any surprises to you or anything that seemed kind of counterintuitive?
Nothing that seemed counterintuitive, but it sort of validated what I felt like I was hearing and seeing from my colleagues in the benefit space, that really that focus on well-being is super important and is a priority. And I do think that somewhere along the way, I know this is going to sound maybe very basic, but somewhere along the way, we've kind of forgot about hey, prevention, get your screenings, do the physical fitness, take care of your mental health. I think we talk about a lot of it, but I think we haven't really focused as much on very distinct aspects of well-being that those things are. And we've kind of had this really broad approach to it in the last 5 years or so. And I think that that's what I'm seeing is this like super focus with the well-being LSA.
That's great. Yeah, I think that's something that could be appealing to many employers, right? I mean, if you look at the top drivers of healthcare costs right now, generally, cancer is up there, unfortunately, and that's one of them. Or for not all cancers, but for certain cancers, if you have your screenings done, definitely it can save employers money and help increase survival rates for employees.
Yeah, I think part of the well-being, and this goes back to the ROI, is that both health and sickness take time to evolve, right? So like you can go from a healthy individual to an unwell individual, and it might take, several years, but you might not even be at the same employer. So that claims history might not even follow you anywhere. But I think that the ROI aspect is always tricky when it comes to well-being, because that happens over, you're basically cost avoidance. You're
Right.
avoiding what you don't really know is going to happen in the future. You think you're avoiding something that's going to happen in the future, a future event, whether it's a heart attack or maybe cancer or something else like that. But it's hard to kind of get that concept to resonate sometimes. And it just takes such a long time to actually see results. And sometimes, as I mentioned, when the workforce moves on, or, you just don't have apples to apples year over year.
Fair points. One thing I want to pick your brain on, right? Let's talk a little bit more about LSAs as it relates to talent recognition or retention, or really just ultimately a total reward strategy. Have you seen LSAs really been used for anything as it relates to talent recognition?
Yes, and in fact, we have a rewards and recognition product on our platform as well. We do see it. We see a lot of customers will use it obviously for the anniversaries, but also, being able to reward people for, job well done, or other types of rewards and recognition opportunities within the organization. So we do see LSAs used in that way. Sometimes people prefer the physical over maybe money. I know that can be a hotly debated topic, but we offered both cash and physical items when we had a wellness platform at Time Warner, and the physical items were just as popular as the cash was. So we also have a store, and we do see people also wanting to gift via the store as well.
Okay, fair enough. So I asked this a few years ago, right? Just out of curiosity, are you still seeing with LSAs, right? So, a few years ago, the talk was point solution fatigue. I still think it's still real in the marketplace, although I will say I think some employers are being a little bit more targeted as it relates to point solutions. Are you still seeing any budget reallocations from, random point solutions towards LSAs?
Yeah, a fair amount. So to the point of the point solution fatigue and sort of the overlap that kind of occurred as the point solutions got broader. You may have started with maybe one disease category and then expanded into pre-diabetes, and then, then GLP-1s and all of that. So it kind of like some point solutions have really expanded beyond what their initial mission was, I guess, is that the right word? Their initial mission. And so there's a lot of overlap. So we are seeing in some cases, employers are looking to streamline and really get to the solutions that are driving, to your point, the most ROI, or getting the utilization, or that the employees are really, really appreciating, as opposed to kind of trying to have a point solution for everything. As we know, there's a ton of gaps in the healthcare system. That's why point solutions exist. They do a good job at filling those gaps. But it's just become a little bit too, I think, unwieldy to understand and to administer.
Fair enough. So Kathleen, let's say there's someone out there and they want to learn more about Forma, or perhaps explore LSAs for their own organization. Where can they go?
You can go to joinforma.com, and you can also hit me up on LinkedIn and reach out to me directly.
Sounds good. Well, Kathleen, thank you so much for coming on the program today. Really appreciate it.
Thank you for having me.
Of course. And for our viewers out there, we want to hear from you guys. What questions do you have on lifestyle spending accounts? Comment below.